look, at 75, it's not a matter of do I want medical interventions. If I happen to be skiing or something, I would definitely take medical interventions. If I, say, broke my hip or injured my knee, that's definitely the case. And if I'm in serious pain, I would take pain medications. The thing I was saying is that what I don't want to do is, say, take chemotherapy if I got cancer at that point. And those are important distinctions. I'm not saying stop medical care, which is what the title and a lot of the language around this suggests.
Okay, but Dr. Emanuel, there are a lot of interventions. I'm going to put them on the screen that you say when you hit 75, you're no longer interested in. Regular preventive tests, screenings, interventions, colonoscopies and other cancer screening tests, cardiac stress test, pacemaker, implantable defibrillator, heart valve replacement or bypass surgery, flu shots or antibiotics, ventilators, dialysis, surgery, medication. God forbid, if you get cancer, you're just going to let it ride?
Yes, sir. And you know what, Michael, a lot of those interventions, they're not necessarily pleasant interventions, especially cancer chemotherapy. I'm an oncologist, as you mentioned, and I know a lot about them. And I think the real question is not at that moment. The real question is, how do you want to live your life? What does quality of life mean to you? And I'm pretty clear about what it means to me. And the reason I wrote that article was to suggest that people need to be clear about what it means to them. I wasn't telling everyone, do what I do. I said, you need to think about it. You just can't sort of blindly go into old age, which I think unfortunately happens to many, many people. And the medical system will do what the medical system does, regardless of what your philosophy of life is. And what I was urging people, think about what's important to you. What's important to me is to be mentally active, mentally engaged, doing what I can do to make the world a better place. I want to be physically active.
Dr. Emanuel.
I want to be physically active.
Dr. Emanuel.
Yeah.
Your father lived to 92.